Katie, it's good to see you, and thanks for joining me today. And we're here to talk about the great work that Partners in Health is doing to dismantle some of the barriers that exist around equity, both locally in Massachusetts, where we both live, but also globally. So thanks again for coming.
Thanks for having me.
So I'm going to ask you a few questions, if that's all right. So let's start by maybe sharing with the audience what Partners in Health is for those who may not be familiar.
Sure. So Partners in Health is a global health social justice nonprofit. We were founded about 40 years ago in Haiti, and we work with communities and governments around the world to build stronger health systems and more just health outcomes.
It's something that we definitely need in today's environment. And so what do you believe is the most crucial first step to addressing health inequities? Now, that's a big question.
Yeah. So I lead our work here in the United States, so I can speak. I've worked with PH over the years in Sierra Leone and Rwanda and Malawi, but my work now is really focused here in the U.S. And we at PH use this sort of 5 S's model to talk about health systems and what we need to have strong community-centered health systems, which is space, stuff, staff, systems, and social support. So often outside of the US, in lower income countries, we're often called and invited to start first in working on ensuring there's medications on shelves and staff in hospital wards and safe and dignified spaces. Here in the US, we have more challenges in the systems and social supports arenas. So of course, still some gaps in those first 3 S's, but here we're really focused on building stronger systems that are better designed to serve the most vulnerable or the most historically marginalized communities who have had historical barriers to accessing health care and broader health services. So we do a lot of work here with communities to build more community-driven solutions, elevate community leaders and organizations who have been doing this work for a really long time, but help accelerate their work and leadership to advance health equity in their local communities, and then translate that into state and federal policy to build some stronger national systems as well.
All right, and that's something that our 2 organizations have talked a lot about in terms of listening to the communities locally, because it's not about the assumptions that we bring in, but it's really hearing what they need and then meeting them where they are, right? And I think PIH does that so well. So when you talk about some of that community work, can you tell us a little bit more about the Extended Community Center Health Equity Initiatives that PIH has?
Sure. So we started this work in the United States in 2020 in the midst of the COVID epidemic here. And, we saw so much in a moment of such crisis and so much pain, some bright spots in terms of communities and public health and healthcare systems and the private sector coming together to collaborate in different ways to solve problems and do big ambitious things like the vaccine rollout. And so we've tried to take some of the learnings from that experience and continue that deeper work in communities to continue to hold collaborative infrastructure together that really creates tables at which folks can sit, learn from each other, discuss and reflect on the health equity challenges in their communities, and to help identify and collaborate on solutions. And most important in that is community leadership and guidance and perspective on what are the most critical issues folks want to address together, what are the resources that are needed, what other kind of power shifts or information flows or resource flows, data flows need to change to really address those systemic challenges, as well as address and alleviate immediate needs, suffering challenges today. So that looks a little bit different everywhere we work, but we've been really thrilled to get to partner with Takeda and some of our work in Massachusetts to focus on these health equity communities of practice, which is one vehicle or avenue to do that kind of community-driven solutions work.
And so tell me a little bit more about those communities of practice.
Yeah, so we've been so privileged to be invited in the city of New Bedford, which is in the southeast coast of Massachusetts, a strong immigrant city and community that has some great leadership at the local health department and a number of amazing community organizations who PIH has been supporting and accompanying to come together and look at the data in the city, look at the history of racial disparities in health outcomes and access, other inequities, and say, what do we collectively want to try to do about that together? So this community of practice has been meeting regularly, and it's so amazing to see, people from the mayor's office or the police department, as well as the local CHC or the hospital, as well as community organizers and activists. The YWCA has been incredible leaders of some of the convening work, and seeing those folks get together, talk about the issues they're seeing in their communities, and start to align on a set of priorities about what they want to do together to move solutions forward. So we just getting to that phase where the community of practice has identified 3 priority areas that they want to focus on. And while organizations may be coming in, or individuals may be coming in with a primary interest in housing or food or childcare, they've collectively identified three policy areas they want to work on that we're really excited to see now start to translate into some new programming, some new resources. And we hope this is a model that can be replicable in other similar communities in Massachusetts.
Yeah, that ability to scale up is so important, right? And you're describing basically, I mean, it takes a village, it does, to try to address these inequities. And I think one of the other village members, if you want to call it that, are the community health workers. So can you tell us a little bit more about the role that they play?
Yeah, so community health workers are trusted members of communities who are engaged to accompany patients and families, community members, in their journey to health and well-being. And so here in the United States, community health workers can have over 90 different professional titles. So you may know community health workers, but not know their CHWs yet. But community health workers are incredible educators, navigators, advocates, accompagnateurs, organizers. And we at Partners in Health have been so inspired and led by community health workers in our work all over the world. Of our 19,000 employees, 10,000 are community health workers around the world. We work with tens, probably hundreds of thousands more employed by other partner organizations. And so here in Massachusetts, we're not here, we're in beautiful Aspen, in Massachusetts, community health workers in New Bedford, for example, have been employed by the city health department, by the local health center, by a range of community organizations. And so we see CHWs as just essential, frontline, trusted members of the community who can help patients and communities address a wide range of needs. I could say a lot more, but I'll stop there.
Yeah, great. Yeah, and I think that trust is such an important part of what makes that work. And so, we've recently announced an expansion of our partnership between Takeda and Partners in Health, and something that we value quite a lot at Takeda. Would you be willing to share a few details of how we're going to work together to help address some of those social determinants of health in Massachusetts?
Yeah, so we've been so thrilled to have Takeda's support for that community of practice work I was describing in Massachusetts, in New Bedford, and now looking at how we can expand or replicate that elsewhere in Massachusetts. We know we have a shared passion for community health workers and the critical role they play in building more community-centered, equity-centered health systems. And so we have amazing partners at the Massachusetts Association of CHWs as well, and are hoping we can support the continued investment in that workforce across the state to really continue to strengthen, again, that really community-centered and community-accountable service delivery and advocacy work.
Yeah, and we're really looking forward to seeing what we can do together in that space. And so if you had, one change that our communities could make today that will start a process towards more sustainable change, what would that be? What advice would you give?
I wish I had a one silver bullet answer for you, but I think, I really do believe these two pieces of work we're doing together are really exemplary of what's needed in terms of addressing such fragmentation and siloing in our health system that is so hard to navigate even when you have all the resources and support in the world. And so I think having community health workers who can accompany folks on their journey to health and navigating care and services, it can be just transformative for individuals, families, communities, particularly as we're able to scale and support that workforce sustainably longer term. And then I'd say these sort of community of practice models as well are not just about identifying a specific technical or programmatic issue area or solution, but about building deep relationship and collaboration and trust that can build power and shift power in terms of who's making decisions, who's around the table, and then who's making decisions at the table to really build more equitable systems in the future. So, yeah, I think we're on the right track with those two pieces of work.
Well, great. Well, thank you so much, Katie, for joining me today, and we really value our partnership together, and I look forward to seeing what we end up doing.
Yeah, well, thank you for your support.